All right. Well, thank you everybody for being here today. I'm really excited to have this conversation. Got a friend of mine named Jackson O'Brien. I'll let him do his intro. But we're going to talk today about integrating the Mac into your operations, right? So we're talking to an actual pool operator who's actually running facilities, who's actually having to do this thing, and who's actually having to integrate the Mac. So really, really great learning experiences. So Jackson, would you do the honors and just kind of introduce yourself and who you are?
Yeah, of course. I mean, first, thank you for having me on. I super appreciate being able to have a conversation with you about this. I think it's going to be a lot of fun. My name is Jackson O'Brien. As you said, I work at the South Shore YMCA, so just outside of Boston, Massachusetts, and I am the Aquatics Training Manager. So I oversee basically like the initial training of our lifeguarding staff, as well as our lifeguard instructors, and even a little bit of our swim lesson instructors. We have at the branch that I'm at about 130, 150 aquatic staff. It fluctuates a little bit depending on the time of year. We've got two indoor pools and two outdoor seasonal pools.
Oh, oh, wow, that's a nice operation. I didn't
Yeah.
realize your staff was that big for one site. That's good.
Yeah. I mean, we're
Yeah.
very fortunate here to have a pretty well-staffed facility, and thanks in part to the fact that we run a lot of lifeguard courses year-round, so we can hire from that, which has definitely been super helpful, especially recovering from the COVID fiasco a
Yeah.
couple of years ago.
We might have you on later, when we talk about recruitment and retention of lifeguarding. Yeah, I think you'll have some really, really neat insights there. That's a different day, right? So, Jackson, we can you tell me about your Mac journey? Why did the South Shore Y start looking at this? And what was your role in it?
So I forget exactly when I first learned about it. It's probably 3-ish years ago, 3 or 4 years ago, maybe at this point. Um, and I didn't really know exactly what I was looking for. I remember trying to like find answers to questions about like facility operations and how things were supposed to work. Not really realizing that there was something out there where a lot of this had already been done. I hate reinventing the wheel, right? So if we need to do something at work, if we're trying to do something at the Y, I'm first always try and find someone else that has done it successfully and then, steal their ideas and bring it to the Y. So I was looking into like just general facility operation stuff, like trying to kind of like level up what we're doing here in terms of, whether that's like training new supervisors or making sure that the lifeguards are testing the chemicals appropriately, or, helping to make sure that our water chemistry is more stable, over long periods of time. So all that kind of stuff has been like going through the back of my head for a while. And through doing some research on the internet, I stumbled across the Mac. And I'll never forget when I was looking at it for the first time. It's like, wow, this is incredible. I can't believe that there's a resource that has all of this stuff put together. It was kind of skimming through. And then it shifted to, wow, there's a lot of material in here. And, a lot of it is not necessarily directly related to what we're doing at the Y. Our facility is already built, right? So the first, I don't know, quarter, third of the MAC seems like it's designed around creating a facility and what needs to be done in the engineering and design stages. Of course, we're more in the it's already been built and how are we running it phase. But it's been really great to see that it kind of touches on even like the lifeguarding and the staffing aspect, at least a little bit, as well as the chemical operations and all of that stuff. It's been enlightening to learn about everything that's out there and how things are ideally supposed to operate. And it's been incredibly useful in having conversations with management and with like directors and levels, all the way up to our CEO. It helps kind of give some credibility to the things that we're trying to work on improving.
That's interesting, right? I think that's something that is worth maybe expanding on a little bit. It's definitely worth like really digging into how that can help somebody else, right? So let's kind of circle back around to that, right? Can you name a specific situation where you took the Mac to your superior's desk and was successful in, advocating for a change?
There's been there's been tons of conversations around like things that we are in the process of improving. I'm trying to think of one in particular that would be like an easy example to talk about. I mean, I suppose lifeguard staffing a little bit. It's not something that we have struggled with much around here. Like for the most part, our facility knows that like we need to operate with a certain number of lifeguards in order to safely operate the pool. Um, but I was able to have conversations with staff around like it's not my individual opinion that we should have, for example, like a minimum of two lifeguards when operating a pool. I'm pretty sure that's what the max says for, I think, one pool with a single zone, you need a minimum of two to respond to the EAP. Um, that was kind of like reinforcing to be able to say the model aquatic health code, right, from the Centers for Disease Control and Prevention, like this, you know, organization that knows what they're doing and knows what they're talking about, they say that this is the safe way, the ideal way to operate a facility. So it's kind of like aligning with what we're working towards. And this isn't to say that when having these conversations with people that it's not just, dismissed because this coming from an individual person, but I think people's understanding of like how the conversation is going changes a little bit when you say this is why we should be doing this, and here's this really big organization that says it's, the right thing to do. It's also helped a lot with kind of giving some extra information, because we are also kind of using the Aquatic Safety Guidelines for Ys document. I'm pretty sure that's what it's called, from the Y of the USA, right? So they've kind of gone out to the Ys and said, here is, I suppose, like their interpretation of the MAC, and then they kind of build onto it a little bit or modify it slightly specifically for YMCAs. So the two documents we've been using kind of at the same time almost, because that Aquatic Safety Guidelines for Ys document references the MAC constantly. So using both of those in combination has been really helpful.
That's good. What was your facilities journey, right? Is this something that you just kind of brought to the table saying, "Hey, I'm doing this research. I'm looking at this. We need to go this direction." Was there a broader, impetus to it that, you're required to look at it, right? What's the journey for even going to leadership with the Mac? Was there a specific catalyst, or was it just you as an emerging leader saying, "Hey, there's a better way to do it, and this is it"?
It's kind of come from two different directions. I mean, what you were just talking about is definitely part of it. That, from my perspective, that's how it kind of came to fruition. But unbeknownst to me, as I was kind of going through this journey on my own, our associate executive director for the branch was also, working with like our leadership team and whatnot, knowing about the Aquatic Safety Guidelines for Ys document, kind of working like from the top down to start the implementation process of that, while I was working from the bottom up, like learning about a lot of this stuff, recognizing that this was something important that we needed to do as a facility. And then when I when I went to go talk to her about the MAC, she's like, that's awesome. And also, here's this other document that we can use, and we're having these conversations. We need to make all of this stuff happen. So it was kind of funny to know that those things were happening at the same time. And I think we're all on the same page here that we want to run the best aquatic facility that we can. How do we do that in a way that is like financially feasible and within the constraints of like operating in the world that we live in? So, it's a slow process, right? It takes time to do all of this stuff. But it's so awesome that the conversations are already happening, and that it's happening from multiple different people in the organization. I think holistically, we're in the early stages of using the MAC to, bring the facility up to that next operating level. This is something that is definitely going to take time.
Yeah, definitely. And that's the cool thing about the Mac. It's always evolving, always growing, and it's in some ways a living document, right? With the revision cycle, the update cycle. That's what's really, really cool, is that it's always integrating something, right? Whether it's new research or new best practice. So you mentioned about the financial side of things briefly, and you may or may not have any insight of this in your role, right? I know budgets are complex. I'm thankful that in my full-time role, I don't have to look at budgets. So I'm very, very thankful for that, right? Do you have any idea on what financial impact the MAC has had on your Y? Has it been significantly more neutral, a little bit less? Any idea?
Not really. I mean, I kind of see from an outsider perspective on the budget, maybe like a little bit. But again, fortunately, much like you, it's not something that I work with. I mean, I'm a part-time employee at the Y. So while I spend a lot of time here working with the training and whatnot, the budget stuff is not something that I get involved with much. I will say, though, that as I've been going through and kind of like taking notes and outlining, like, what are things that we can implement now? That's just a policy change, right? We just need to get everyone on the same page, change the policy, and then we're good. And then the opposite end of the spectrum, that would be like, I don't want to say redesigning the facility, but like significant financial investments in changing infrastructure, right? Kind of identifying like where the different parts are on that spectrum. There are some things in the MAC that, like realistically speaking, if we're able to eventually incorporate those, it's going to be a while because it will be, a significant financial burden. I'm thinking specifically about the the lighting aspects of like outdoor pools. We don't run our pools at night. We specifically operate when the sun is out. Eventually, if we wanted to start doing nighttime swim or something like that, we'd need to get under pool lighting and go through that whole process. But that would be a significant expense and something that the MAC touches on.
Yeah. A big one is just UV,
Yes.
UV systems, secondary treatment systems. It's those can be a little bit pricey, and sometimes you've got to build in the budgeting process to be able to do that.
Yeah.
Because a UV system on a 6-lane, 25-yard pool, it's not necessarily cheap. It's definitely at least a 5-figure budget item. So
Yeah, and those are conversations. I'm glad you brought up the UV. It's something that we have in the outdoor pools because those are, I'm testing my memory here. I think this upcoming summer will be the fourth summer since we completely reconstructed the outdoor center. So that has UV, which is great. Our indoor pools don't have it yet, and we've been having conversations for a while about the benefits of getting UV. And the MAC has been involved in a little bit of those conversations, right? It's just another thing that's kind of piling onto the reasons of why we need to get this and when we can get it. So it's definitely been helpful to use in that circumstance.
oh, good. That's good to know. Good stuff. Um, so just from a practical aspect, anybody who's watching, one thing I want to point out, you mentioned you're part-time, right?
Yeah.
Which, is absolutely amazing that here's a part-time employee that's, honestly driving a massive change in this facility, right? So that's definitely want to give kudos to you. That is no small feat, my friend. That is no small feat. How's been how has been the staff reaction, right? So getting away from the CEO, getting down to your lifeguards, right? Your aquatic leadership team, right? What's been the reaction to the MAC at that level? Has it been well received? Have you had pushback? Have you had a lot of questions?
Not really. I mean, honestly, a lot of the lifeguards here probably are unaffected by it in the sense that like they don't, I shouldn't say unaffected by it because they are. They don't know that the changes are necessarily coming from the MAC. Like it's not something that I will bring up in conversation with every lifeguard, like when I'm explaining, why we have a certain policy. I've had conversations with our lifeguard supervisors around like, hey, we're changing this policy, or we need to make sure that the chemicals are within a certain range for these reasons. And then I go into, a little bit of a more in-depth explanation, like the state outlines that it needs to be within this range. The model aquatic health code says that it needs to be within this range. And, depending on basically the interest level of the staff, I'll either talk about it in more depth or just kind of leave it at that. Usually, if I say MAC, I'll say it's the Model Aquatic Health Code from the CDC, because personally, I feel like it's important for staff to at least know what that acronym is, to have heard it before. Um, yeah, it's typically a conversation that we're having like with our aquatics director or our associate executive director at the branch.
Cool. Have an interesting question. So Massachusetts has, bathing codes, right?
Yeah, I know where
How
this is going.
I'm curious, right? Your inspector comes in. What's the conversation been like with the inspector? Has that been overwhelmingly positive? Have y'all had, information to go back and maybe debate a citation or a fine, right? What's that relationship been like since this journey?
So I don't want to get into too much detail with it just
Sure.
because I haven't been present for like all of the conversations with the local inspector. I mean, I hear about all of the conversations from like our facilities director, that's our CPO of record, and our aquatics director that works with the health inspector. Um, I will say that we have a pretty good relationship with them. As far as I know, we are the largest aquatics facility in the town, right, that they work with. So it is definitely a symbiotic relationship where like we are showing them that we are doing the best that we can. And that we're striving to improve, and they, from my understanding of it, are willing to work with us and you know recognize that of the world.
Yeah. So maybe it's buying a little bit of goodwill. Maybe it's buying a little bit of extra influence. Maybe it's buying a little bit of, hey, these guys are on point and I'm going to worry about them less. Would those be fair statements?
Yeah, I think so. I've always I've been thinking about the course that I've seen on social media. You're gonna have to help me out here with the name of it, but it's like the Aquatic Venue Inspector course that CMAC is putting out, I believe. Um, and I've been thinking a lot recently about like it is this something that our health department knows about? Is this something that we could help them to learn more about? Um, because it seems like it would be a mutually beneficial thing for them to go through. And again, this is just my ignorance here. Like maybe they already have. I honestly don't know, but it's definitely on my list of things to talk with my management staff about. Like, hey, when we're working with our health inspectors, like, are there things that we can do to help support them and their education so that we can work, more effectively with them?
Yeah. I'll just do a quick plug here, right? So, folks, what Jackson's talking about is the CMAC Aquatic Venue Public Health Inspector course. We call it AVPHI. We're just moved it out of beta phase like last year, and it's definitely a growing course. It's not your typical inspector course. It's Mac based, and what's more important is it focuses on what's really needed in the inspection, right? We don't talk about LSI in the inspector course because LSI is a facility issue, it's a structure issue, it's not a public health issue. So it's a really good course. We had a good group of volunteers to build it. So if you're interested in it, hit me up on LinkedIn, YouTube, the emails, right, the interwebs, all that fun stuff, and we'll have a bigger conversation about it. So, but thank you for that plug. So
Yeah.
yeah, yeah. So last couple of questions, Jackson, right? What was what was your biggest surprise in going through the max so far?
Mm, that's a good question. So my aquatics experience, I mean, for the most part, is based around working at the Y, right? This was the first job I had effectively. It's been a little over 10 years of working at the Y. And it's been an awesome journey. I've been really fortunate to work with a great team of people. And just to circle back to what you were saying earlier, like doing this as a uh, staff member, I've been supported by our associate exec, and I've been supported by our aquatics director and many of our lifeguard supervisors here. Like we are all kind of seeing this need to grow to the next level. Um, So, it's a team of people, right, that takes um,
Yeah.
working together to make things like this work. The biggest surprise, I think, as I've been looking through is like the depth and breadth of all of the information that's in there, right? Having really only worked primarily at this aquatics facility, most of the knowledge that I have about mechanical systems is from working here, right? So going through and looking at the MAC and hearing it talk about what was I just looking at the other day? Ozone systems. We don't have an ozone system here. So I'm going through and looking at how that's referenced in the MAC, learning about this, not necessarily for the first time, but seeing it, this in depth around like the recommendations on what levels to maintain and whatnot has sparked an interest and kind of went down a little bit of a rabbit hole reading about ozone systems. And I just didn't really realize how many different aquatic venue setups are out there. That's been really cool.
Yeah. And it's growing every day. I
Yeah.
hear new stuff all the time. It's just wild. Um, so what so you're talking to Jackson 3 years ago, right? When you first started looking at this thing, first started looking at your journey and your facility's journey down the Mac rabbit hole, right? What would you give Jackson 3 years ago? What advice would you give to him or someone who is doing what you're doing, right? They're taking the Mac, they're trying to integrate in their operations, they're trying to figure this thing out, right? What advice do you have for them?
Well, like first and foremost, just like know that it's possible. You don't have to do everything in there all at once. Like find the low-hanging fruit. Find the things that are maybe like policy changes if that's the easiest thing to implement at your facility. Like find the smallest, easiest thing to implement and have that be a success, and then use that as a model for talking with staff and talking with leadership or management about like why this is a step in the right direction and how this is not something to be afraid of. It's not something that there's any benefit to resisting, right? We all need to be on the same page, and fortunately, here we are all on the same page about like wanting to move to that next level and operating a an aquatics venue safely. The bite-sized chunk thing, I could have definitely used someone telling me that at the beginning. I did kind of try and dive in and like look at everything that we need to focus on and then try and do a little bit in each of the steps at the same time. And it's just, especially as a part-time staff, it's too much. Um, but also, I have to be honest, I was a little bit nervous when I first read about it. Like, am I crazy for wanting to bring this up? Like, is this actually something that I should be doing, that I should be looking into? And I have been so, so, so pleasantly surprised with the reaction, especially from our associate executive director here about like being encouraged to learn about this and to bring this into our facility and level up. Um, and that level of encouragement, I mean, has kept me going and reading more and learning more and bringing up in meetings and trying to make all of this stuff happen. So I've been really lucky in that case too.
Oh, that's good stuff, man. There's
Yeah.
going don't be surprised if our comms director, Betsy Watson, she may pull some of those out and use as quotes, right? Because you said some really, really, really good stuff. Um, we're almost done, right? For now, I think this has been great information coming from you. It's always great to hear from someone in the trenches doing this day to day, right? What final thoughts do you have, right? You're talking to our audience now, you're talking to whoever's watching this, right? What final thoughts do you have for them?
Knowing that it's possible was huge. I mean, if I could like go back and tell myself 3 or 4 years ago or whenever it was, like you're on the right track, do this, learn more, and know that you're going to find success with this along the way. I think I would have definitely jumped into it even more so back then because there was hesitation with it. Um, the aquatics industry is so varied, right? Like on one hand, every facility is the same, like lifeguards face the same problems at every facility. But on the other hand, like if you've seen one aquatic facility, you've really seen one aquatics facility. And, you know, using the Mac is not something that you have to do 100% of right in the beginning, right? Find the areas that you can easily incorporate and work on those. And then I think probably the other thing is that it, the weight that the CDC has in conversation with people is much more than I would have initially thought. Um, when I talk to non-aquatics people here at the Y, they don't know what the Model Aquatic Health Code is. So I always say the Model Aquatic Health Code from the CDC that they put out, right? I wouldn't have thought initially that making the link between those two was important to have in conversations with non-aquatics professionals. And I wasn't doing that initially, but now kind of looping that part in so that everyone is on the same page. Like, this isn't just a document that like three people sitting in a room somewhere put together. This is industry experts, right, leading the way to the future of healthier and safer aquatics facilities. And they're saying that this is what we should be doing. So let's, jump on the bandwagon and, work towards making it better.
I don't have anything to add to that. That's great. Folks, we're going to leave it on Jackson's words. There's nothing else I can add. Jackson, thank you for being here. Right, everyone, thank you for watching. You can find Jackson. He's all over the place. Right, Jackson, is there contact information if someone like you wants support? If you're willing to do that, say it. If not, we can certainly factor that in elsewhere.
Yeah, no, people can definitely reach out to me. I'm happy to support in any way that I can. Probably the easiest way is to find me on LinkedIn. I'm just Jackson O'Brien. I'm sure my name will be written in here somewhere. You can find me on LinkedIn.
Sounds good. Find Jackson, folks. He can help you guide through it. We're always available. Thank you, Jackson. Thank y'all for attending, and thank y'all for listening. And we'll see you on the next one.